Welcome back, my dear students. Today we are going to explore the fascinating world of allergies, an abnormal hypersensitivity reaction of our immune system to substances that are usually harmful, like pollen, dust, certain foods, or medicines. Instead of ignoring these allergens, our immune system overreacts, releasing chemicals such as histamine, which cause symptoms like sneezing, itching, rashes, or even breathing difficulties. The interesting part, allergic reactions are not all the same. They are classified into different types of hypersensitivity reactions, each with its own unique mechanism. Some allergies are mild, like hay fever, while others, like anaphylaxis, can be life-threatening if not treated quickly. In this class, we will learn the basics of allergy, the types, the mechanism behind allergic reactions, the diagnostic tests doctors use, and the preventive or prophylactic measures to manage them effectively. Let's dive in and make the science of allergy, make the biology of allergy made simple and easy to understand for your students. What is allergy? My dear students, an allergy is an abnormal reaction of our immune system to substances that are normally harmless, called allergens. Instead of ignoring them, the immune system treats them like dangerous invaders and overreacts against them. Examples of common allergens: pollen, dust mites, animal dander, mold, etc. Certain foods like peanuts, shellfish, eggs, milk, etc. Insect stings, medicines, and some other chemicals. Most allergic reactions belong to type 1 hypersensitivity or IgE mediated. So the allergic symptoms include rash, edema, itching, reddening of the skin, vomiting, nausea, conjunctivitis or watering eyes, swelling of eyes, cough, stomachache, diarrhea, ailment, etc. Types of allergic or hypersensitivity reactions. The Gale and Coombs classification divides allergies into four main types. Type 1, that is immediate hypersensitivity or IgE mediated. How it happens? First, contact with allergen. Body produces IgE antibodies. IgE then sticks to mast cells. On re-exposure, allergen cross-links with IgE and mast cells release histamine and other chemicals. What is the result? Sneezing, runny nose, swelling, itching, wheezing, etc. Examples include hay fever, asthma, hives, allergic conjunctivitis, and severe anaphylaxis. Treatment procedures include antihistamines, corticosteroids, epinephrine for emergency periods, etc. Now we'll go for type 2 hypersensitivity, type 2 cytotoxic hypersensitivity or IgM or IgG mediated hypersensitivity. How it happens? Here the antibodies are attached to our own cells, marking them for destruction. Examples include drug induced hemolytic anemia, transfusion reaction, good pasteur syndrome, etc. So treatment includes stop the offending drug or antigen, used immunosuppressants. This image shows the first one, type 1 or IgE mediated or allergic hypersensitivity, which is caused by allergen triggers IgE on mast cells, releases chemicals. The examples include allergies, asthma, anaphylaxis. Type 2 hypersensitivity is IgG or IgM mediated cytotoxic mediated cytotoxicity. It is caused by antibodies bind to body's own cells, so cellular destruction occurs, and examples include blood transfusion reactions, Rh diseases in newborns, etc. Type 3 or immune complex mediated hypersensitivity, which is caused by antigen antibody clumps form and caused inflammation. Examples include lupus, rheumatoid arthritis, kidney disease, etc. Type 4 hypersensitivity is cell mediated and it is caused by T cells react to antigen which causes inflammation. Examples include contact dermatitis, type 1 diabetes, TB test reaction, etc. Type 3 or immunocomplex hypersensitivity. How it happens? Antigen antibody complexes form in the blood. It is deposited within tissues, causes inflammation. Examples include serum sickness, lupus, post streptococcal glomerulonephritis. Symptoms include fever, rash, joint pain, kidney issues, etc. Treatment includes remove antigen, anti-inflammatory drugs, corticosteroids, etc. Type 4 or delayed or T cell mediated hypersensitivity, it when it happens or how it happens when T cells, not antibodies, drive the reaction. Its onset occurs after 1 to 3 days exposure. Examples: contact dermatitis with nickel, poison ivy, TB skin test, chronic transplant rejection. Treatment include avoid allergen, use corticosteroids, immunosuppressants if severe. Diagnostic test for allergy. Common allergy tests include the blood test, skin prick test, or oral food challenge. So history and examination, check symptoms, then exposure and check the family history. Skin test includes skin prick test or SPT, which is quick and shows immediate allergic reactions. Intradermal test for drugs or insect venom, which is more sensitive. Patch test for contact dermatitis, that is type 4 mediated hypersensitivity. Blood test, total IgE, specific IgE like rash or ELISA, eosinophil count can be performed to diagnose allergy. Provocation test, control allergen exposure, done only in hospitals. Prophylactic or preventive measures, avoid allergens, was bedding in hot water, use dust proof covers, keep rooms dry, avoid pets or pollens if allergic. Environmental control, use HEPA filters, vacuum regularly, avoid smoke. Personal protection, masks, gloves, careful food label reading, etc. Medicines, antihistamines, corticosteroid sprays, leukotriene blockers, mast cell stabilizers. Allergen immunotherapy, which is desensitization, gradual allergen exposure via injections or drops to build tolerance. Emergency care, high risk patients should carry on epinephrine auto injector or EpiPen and wear a medical alert bracelet. Summary: allergies are simple the immune system's overreaction to harmless substances. By knowing the types, symptoms, taste, and preventive strategies, we can manage allergies effectively and live a healthier life. I hope this class helped you understand allergy, what it is, why our immune system overreacts to harmless substances, the different types of hypersensitivity reactions, and how these mechanisms lead to symptoms like sneezing, rashes, or even severe conditions like anaphylaxis. We also explored how allergies are diagnosed using skin test, blood test, and family history to check the family history, and most importantly the preventive and management strategies like allergen avoidance, medicines, and immunotherapy. Remember, awareness and timely action are key to keeping allergy under control and living a healthier life. So stay safe, take care of your environment, and help spread awareness among friends and families. If you found this class helpful or useful, don't forget to like, share, and subscribe. See you in the next class. Thank you.